I think one of the most important things we need to do, though, and this is sort of, we need a multi-pronged attack, really, to change things dramatically, which they do need changing dramatically. And that is, we need to absolutely, as Steve said, we need to look at the health of the nation. And it has gone down and down and down, with obesity and chronic disease becoming ever more prevalent. And the problem with the NHS is it treats symptoms and it doesn't go for root causes. And we really need to change that mindset for everybody. We need people to take responsibility for their own health. We need people to look at their diet, their exercise. The food industry needs to be tackled with all the processed foods and all the junk stuff that they put in, the chemicals they put in there that are addictive. So people become addicted to these foods and have to, want to eat more and more and more, and then they become obese, and that brings on the heart disease, the diabetes, et cetera, et cetera. So we've got to try and change the mindset of the population. And I think that starts with education at school. We need to run education programs for our children to teach them about nutrition, teach them about how to cook. I mean, that was all lost from the curriculum, so important. Teach them about exercise. Don't close the sports fields, open everything up to children, have after school classes and clubs where they can do activities and become used to that habit from young. So important. And people taking more responsibility for themselves, and then integrating into the NHS services that look at the root causes of things rather than just treating the symptoms with drugs. And there's so much that can be done to help people. It can be transformational by just simple health style measures.